Hi everyone. In this video, I'll be sharing the various tricks to remember pediatric milestones. Milestones are basically divided into four domains: gross motor, fine motor, language, and social. Coming to the gross motor milestone, at 3 months, head control is achieved. That is the neck holding. So you can see this tree. Baby achieves head control. Then at 4 to 6 months, basically at 5 months, baby rolls over. Rolling, you can remember rolls is a 5-letter word. So at 5 months, baby rolls. Then at 6 months, sits with support, that is tripod posture. And you can remember that sit rhymes with 6. So sit and 6. 6 months, sit with support. Then at 8 months, sits without support and crawls. That is chest and abdomen touching the ground. So you can remember snakes crawl. So 2 snakes forming a 8. So at 8 months crawl. Then at 10 months stands with support. So you can write a 10 like this. So 1 becomes a stick. So baby is holding a stick. So 10 months stands with support. And also at 10 months creeping. Creeping is like crawling, but chest and abdomen is not touching the ground. So at 10 months creeping. Then at 11 months cruising and pivoting. Cruising is holding, child holds onto furniture or any object and moves sideways. Then at 12 months stands without support and walks with support. Then at 15 months walks without support. 18 months running. 2 years 2 foot per step climbs upward. Then at 3 years 1 foot per step climbs upwards, and 3 years tricycle. You can remember tri means 3, so 3 years tricycle. Then at 4 years 1 foot per step down and hops. You can see the child is hopping. So you can see the 4. Then at 5 years the child skips. Coming to the fine motor milestone, at 0 to 3 months there is no fine motor movements due to the presence of palmar graph reflex till 3 months. Then at 4 months bidextrous graph, baby grabs with 2 hands. You can see the 2 fours. Then at 6 months unidextrous graphs with graphs with 1 hand. You can remember like unisex saloon, unisex. So uni means unis for unidextrous graph and 6 for 6 months. Also uni means mono, that is single. So monosyllables at 6 months. Then also at 6 months there is ulnar or immature palmar graph. So baby graph is this side, like ulnar graphs or immature palmar. Then at 6 to 7 months baby transfer objects from one hand to another. That is basically compares to objects. So you can remember like सात समुंदर पार सामान या ऑब्जेक्ट को ट्रांसफर करना 7 समुंदर पार. तो 6 to 7 months transferring of objects or comparing of objects. Then at 8 months mature or radial palmar graphs. You can see this is the mature radial palmar graph at 8 months. Then at 9 months immature pincer graph holding with a side of finger. Then at 12 months, mature pincer graph holding with tip of finger. You can see tip of finger. If mature, immature is not specified in the question, then assume it is a mature pincer graph. So you can remember like pincer. So P if you do like this, so it becomes like a 9. So 9 months immature pincer graph, and the R of pincer if you write like this, so it 1 and 2, so it becomes like 12. So at 12 months mature pincer graph. Then at 2 years undressing, at 3 years dressing but needs help with buttoning and unbuttoning. Then at 5 years, baby doesn't need any help. He can dress, undress completely and tie shoelaces at 5 years. Then 12 months, the baby can drink from a cup. At 15 months, baby can drink anything with a spoon, but he spills. At 18 months, he can feed himself with a spoon without any spillage at 18 months. Coming to the drawing, you can remember either by the drawing by this picture or by a mnemonic. Coming to the picture, at 15 months, child scribbles. So the hair represent that scribbling. 15 months scribble. Then at 18 months, child can draw a vertical line represented by the nose. At 24 months, horizontal line represented by the lips. At 3 years, circle represented by the face. Then at 4 years, cross represented by the body. Then at 4.5 years, square. Then at 5 years, triangle. Triangle is represented by the legs. Then at 6 to 7 years, diamond represented by the feet. You can also remember that square has 4 sides. So this 4 and the S of side become 5. So square at 4.5 years square. This mnemonic also you can remember the sequence. Logs STD is the mnemonic. L stands for line, O stands for circle, X stands for cross or plus, S stands for square, T stands for triangle, and D stands for diamond. Then coming to the tower of cubes, at 15 months, 2 cubes. At 18 months, 3 cubes. At 2 years, 6 cubes. And at 3 years, 9 cubes. So you can multiply, just remember 15 months 2 cubes and 18 months 3 cubes. And you can multiply these values by 3 to get 2 and 3 years. Like 2 3 are 6 and like 3 3 are 9. So like this. And this 2 and 3 comes here, nature. Then at 4 years, the baby can form with the cubes, baby can form a bridge. At 5 years, gate, and at 6 years, step. So imagine like we are going to a house somewhere. So first comes the bridge. Then before entering the house, there comes a gate. And after entering, there comes a step, like the steps you climb after entering the house. Okay. So these are two or three stories to remember. So at 4 years, remember foul play. So child going downstairs to play langri, like child hops. And during playing, even when the child wants to pee, he doesn't come home as he enjoys playing. And he's able to go to the toilet by himself. And when the child comes back, he tells all these stories, like what he has done, all the kaname, what he has done to his mother. So at 4 years, child going downstairs means at 4 years climbing down 1 foot. Then play langri. Langri matlab hops at 4 years. Then he can go to a toilet by himself at 4 years. And all these stories, like child is able to tell stories at 4 years. Okay, so hops is a 4 letter word, so at 4 years. Skips is a 5 letter word, so at 5 years. So okay, and foul, if you reverse the order of foul, so FOUL becomes LOUF. So laugh aloud, it becomes laugh aloud at 4 months. Remember laughing in a foul manner, something like that. For 3 years, imagine a child climbing a tree. Tree rhymes with tree, and saying his name, age, and gender, and waving his hand. So child is waving his hand. He climbed a tree, and he says his name, age, and gender. So at 3 years, waving his hand matlab a handlessness, and name, age, and gender at 3 years, and climbs 1 foot per step upwards at 3 years. Then for 15 months, remember child kuch bhi karta hai, like does anything. So 15 months pe scribble and jargon speech, like say anything, meaningless words or anything, jargon speech. Coming to the language milestones, at 3 months, child course. See, remember cooing at 3 months, so C is the third alphabet. So 3 months pe cooing. Then at 4 months, as you had seen previously, 4 months pe laugh aloud. Then at 6 months, monosyllables like ma, pa, babbling at 6 months. Then at 9 months, bisyllables, mama, papa, like that. Then at 1 year, 1 to 2 words. So you can remember 1 year means 12 months. So 1 and 2 of 12 months. So 1, 2, 2 words. 12 months. 1, 12. Then at 15 months, jargon speeds, many words, no meaning. Then at 18 months, 8 to 10 words. 8 to 10 words. 18 months, 1 and 8. 8 to 10 words. Then at 2 years, 2-word sentences. That is around 100 words. 2-word sentences. Then at 3 years, name, age, and gender. Then at 4 years, the child can tell a story or poem. Then at 5 years, he asks the meaning of words. Remember, 5 is like wife, like 5 and wife rhymes like someone. So wife asks meaning of everything, sab puchti hai. So at 5 years, ask meanings of word. Coming to the social domain, at 2 months, social smile, smiles at any human face. Remember, social smile is 2 words like this, or you can remember like 2 like this and make a happy space. Then at 3 months, mother regard. Then at 6 months, smiles at mirror image. You can see two sticks like this, and this is the mirror. Then at 6 months, stranger anxiety. So you can remember anxiety XI, so 6XI, stranger anxiety at 6 months essence. Then at 9 months, the baby wears bye-bye. So you can remember at 9 months like of pregnancy, baby says bye-bye to mother's uterus and enters like a newborn. So 9 months baby wears bye-bye. Also bisyllables also at 9 months.
Both.
Then at 9 to 10 months, baby can play peekaboo. Then at 12 months, baby plays a simple ball game and comes when calls. Child can come when he is called. So you can remember 12 मतलब 12. So 12 मतलब बॉल, बी 12 का बी मतलब बॉल और बुलाने पर आना 12. Then at 15 months he can point to objects. Then at 18 months, remember at 18 months, domestic mimicry. Like the child mimics an adult. You can remember like he becomes an adult at 18 years of age, so somewhat like that. And 18 months, domestic mimicry. You can remember child becomes like an adult at 18 years, so at 18 months, domestic mimicry. Then at 2.5 to 3 years, parallel play, that is playing with other kids, but he is not interacting, he is just playing with himself. So at 3 years, parallel play. Then at 4 years, group play, that is he plays with other persons. And right to left, discrimination, he can differentiate between right and left. Then at 5 years, he can follow 3-step commands and can identify 4 colors and repeat 4 digits. Remember 3, 4, and 5. Other milestones at 6 months, mouthing. Like child puts object in his mouth. Then 1 year, casting, deliberately throwing objects. Mouthing and casting are not permanent, they are only present for 6 months to 1 year. Then at 9 months, object permanence means objects exist even when not seen. Matlab, if a child is playing with a ball and suppose if a ball is lost or parents took the ball or something like that, the child will search for the ball. Then at 3 years, handedness, that is predominantly child uses one hand. Hand regard appears by 3 months and lasts till 5 months. Hand regard means child is looks at hand and plays with his hand. Abnormal persistence of hand regard is an indicator of low IQ. Then coming to the vision and hearing development, in a newborn, following objects up till 45 degrees. Then till 1 month up to 90 degree. Then 3 months up to 180 degree. And binocular vision is established by 4 months. Then child can follow rapidly moving object till 1 year. You can remember bidextrous reach and binocular vision. By matlab 2. So 2 to the 4 months. Coming to bladder control, all of this is not that important. Just you can remember, child can attend to his toilet needs by 4 years. Just remember that. Uh, okay, so just for completion's sake, I will say that the child can say that he or she is wet at 15 to 18 months. Then dry by day. Dry by day means in daytime, baby will not pass urine by, he will not wet it, his pants. He will tell to mother that he needs to go to the washroom. So dry by day by 18 months to 2 years. And dry by night means he will not pass urine in bed. But he will tell his parents that I want to pee or something like that. So dry by night at 3 years. Baby can climb onto the toilet seat by 2.5 years, and he can attend to his toilet needs by 4 years. Coming to the hearing, there is a Murphy sequence of hearing. In a newborn, there is a startle response. Then at 4 months, there is horizontal localization of sound. Then at 6 months, there is downward localization of sound. Then at 7 months, there is upward localization of sound. Then at 10 months, there is diagonal localization of sound. Coming to the assessment, pull to sit, that is the child is lying down and you pull the hands of the baby to make him sit. So in newborn there is head lag because there is no head control. You can see the head is lagging. But by 3 months there is no head lag. So you can see here there is no head lag. Then ventral suspension. Suspend the baby in prone position. In a newborn, head and limbs drop down. Then at 2 months, head is at the level of the body and the limbs drop down. Then at 3 months, head is lifted above the level of body. If a child is placed in a prone position, at 0 to 2 weeks, legs are folded and kept below abdomen. You can see legs are folded and kept below abdomen and the pelvis is lifted up and 0 to 2 weeks. Then at 4 to 6 weeks, legs and pelvis is straight and at level with rest of body. Then at 3 months, you can see at 3 months, elbow is bent and child bears weight on forearm like this. Elbow is bent at 3 months. Then at 6 months, elbow is straight and child bears weight on extended arm like this. Elbow is straight at 6 months. Now, coming to developmental quotient. Developmental quotient is developmental age upon chronological age into 100. Example, if a 6-year child is able to draw only a circle, so therefore the development age of the child is 3 years. Circle you can draw at 3 years, and chronological age is this age 6 years. So 3 by 6 is equal to 50. 3 by 6 is equal to 0.5 into 100 is equal to 50. So development quotient is 50. If development quotient is less than 70, it is abnormal, or you can say it is developmental delay. If developmental quotient is less than 70 in more than equal to 2 domains like gross motor, fine motor, etc. So it is known as a global development delay. It is seen in cerebral palsy. Then evaluation of a preterm baby. If a baby is born at 32 weeks of gestation, so it is premature by 2 months. Each month at 4 weeks. So 32 as a normal term is normal full term is considered as at 40 weeks, but baby is born at 32 weeks. So the difference is about 8 weeks or 2 months. So preterm correction is 2 months. If the baby is evaluated at 3 months of age, that is the postnatal age, at 3 months of age, if the baby is evaluated, then the corrected age will be postnatal age, that is 3, minus the preterm correction, which is 2. So corrected age will be 1 month. So here the child is developmentally considered to be at 1 month old and not 3 months. So correction for prematurity can be calculated till 2 years of age. At 2 years, 90% of brain growth is achieved. So correction can only be done till 2 years of age. Then red flag signs of development. When any of the following milestone crosses the upper limit to develop, then it is considered as a red flag sign. Just add 2 months to the normal developmental time to get the red flag sign. So normally visual fixation of following occurs in the newborn at 0 months. So you add 2, so you will get 2 months. Then head control normally occurs at 3 months. You add 2, you get 5 months. This is the red flag. Then vocalization. Vocalization is normally at 3 months. So you get you add 2 to get 6 months. Then sitting without support. Coming to the red flag signs of development. When any of the following milestones crosses the upper limit to develop, it is considered as a red flag sign. Visual fixation, if you just add 2 months to the normal developmental time, you will get the red flag sign. So normally visual fixation of following occurs in a newborn at 0 months, 0 to 1 month. So 0 plus 2, you will get 2 months. Then head control normally at 3 months, you add 2, you get the red flag, 5 months. Then vocalization, the red flag sign is at 6 months. Then sitting without support, baby can normally sit without support at 8 months. You add 2 to get 10 months. Then standing without support normally is at 10 months, but you add 2 to get 12 months. So standing without with support at 12 months. Then in last one we have to remember, standing without support, walking without support, and single words at 18 months is considered as a red flag sign. Okay, so the drawings which were used in this presentation were by Dr. Arpit Verma, and some of the mnemonics were by Dr. Nikita Nanwani. So thank you all and bye.